Am I audible, Pawan?
Yeah, sir, you are audible, sir. You are audible.
Adama has joined.
No, sir, not yet. I think I asked him. Is yes, no, it's joining now.
Said. Oh, okay.
Okay. So, Dr. Adanma, sir, could you hear us and then you can unmute yourself? Guys, kindly hold on a minute. I'll just check about the guest. I think that there's a little delay in joining.
Hi, can you guys hear me okay?
Yeah, sir. I could hear and see you, sir. Yeah.
Good morning.
Good morning, sir. Good morning. I think it's good evening for us. Yeah.
Oh, yeah, good evening.
Awesome.
Hi, Adda.
Hello, sir. Hi, sir.
So I think, sir, we can start the session. So if you have nothing to say, yeah, we can start, sir.
Yep, anytime you guys want.
Okay, sir. Yeah, sir. Yeah. Hello, guys. I'm myself Pavan, and with me Nikita is here. Good evening to one of our present here. I'm very happy to see you guys again, and I hope like you guys are safe in this pandemic. Before I enter into the session, I would like to thank Dr. Arthanari for making this session possible, and then uh, Mr. Arun from Linux Formatical making this session possible. Today we are going to see about how to handle the USMLE. That's all the basically like talk about this session. So in which we'll be going to see about what about the USMLE process and then the steps and then whether we need to do a observership, externalship, and then about the interview process and lots of stuffs are going to be dealt over this session. To explain all this, we have Dr. Adanma Anji, who did MBBS UG in SRMC and then took internal medicine in Oklahoma University. And then now he's currently working as assistant professor in Department of Hemato-Oncology in Stephenson Cancer Center. Welcome you, sir, to this session. Okay. Okay. Before we go into the session, I would like to summarize how the session is going to be. The first part, it's going to be dealt with the sir, and then next we're going to have a small break, and after that we are going to a doubt session in which you guys can put all of your doubts so that we can answer yours everything. So now I just give over to Nikita. Nikita, please start.
Thank you, Pavan. Before I start, I would like to thank Dr. Adanma once again for having taken time off his busy schedule to talk with us today. So now starting with our very first question for you, Doctor. We all know that USMLE stands for United States Medical License Examination. But what most people ponder upon is what is the pattern and how many steps are involved in this examination per se. So could you brief us on that, please?
Um, so to be very brief on this topic would be that you have the USMLEs and they are a licensing exam to qualify your MBBS degree or any degree that you get from elsewhere and commiserate it with an MD that you would get here in the US. So there are 3 steps: step 1, step 2, step 3. Step 2 has 2 parts, CS and CK. CS being clinical skills, which is a practical exam, and then CK being clinical knowledge. You can take these steps in any order, except that in order to take step 3, you must have finished the step 1 and step 2 before you take your step 3. And you need your step 1 and step 2 before you match. So technically, you can complete your steps before February, when you have to submit your rank order list. So you don't need all of these steps when you interview, but obviously it's a better sign if you have all of them when you interview. Step 3 can be done, I think, depending on which institution you're in. I took my step 3 when I was in my second year of residency. So there's some leeway on when to take that. There are advantages of taking it after you've been in the system and been into the residency process, and some people take it earlier. If you want a H-1B visa, then you need your step 3 earlier. But then if you are okay with being on a J-1 visa like I was, then you can take your step 3 later. And there are certain advantages to a J-1 and disadvantages to a J-1 too.
Okay. So now having said that, so step 1, what would be would they be focusing on the first and second year subjects? And how does that work? How is the weightage for each step?
So I'll try to be very brief about this, because I think you can find what material you need to read and what syllabus it is and stuff. So remember that you're in a competitive process, so it's not a mere pass and fail. Even though there are some changes happening and where your step 1 scores might be a pass or fail, we can get back to that later on. But you really are trying to get the best score possible. Again, it's just one part of your whole application process. So if you have a really good score, that helps. If you don't have a really good score, then there are other things you can do to try and make up for that score that you've lost. But step 1 focuses on your first and second year. So here, United States grads take their step 1 somewhere around the second year of med school, and then step 2 they usually take it around third or fourth year of med school. So if you are technically limiting to our undergrad curriculum back in India, then it would be step 1 is your first and second year subjects. Step 2 would be your third and fourth year subjects.
Okay, that's great, sir. So what would be the various prerequisites for applying for the USMLE?
I think the whole process of getting the NRMP stuff sorted out so that you can take the exam is pretty straightforward. There's a lot of paperwork involved, but most of the medical colleges in India are recognized by the NRMP, so you can just submit some paperwork. I think ECFMG has a list of documents that you might need. They have some forms to fill out saying that you've been through medical school and you're in this medical school and so on. And apart from that, it's not a hard process getting eligible for your steps. So basically, the only requirement is that you are in a city. You're able to travel to a city where there's a test center. So I think for India, that's Chennai, and for Tamil Nadu, I'm not sure if there are other centers that are opened recently. And then you need to be in medical school. That's it.
Okay, sir. So next up, according to you, what is the best time to start preparing for the USMLE?
So I think that's a very difficult question because everybody is different. I had a mentor in my med school who always used to tell me that I needed to start studying on day 1. I, like many others, didn't study for my steps during my med school. I completed all my steps after I graduated my internship. I've had a few friends who gave their steps during intern year when their schedule was not that busy. I've had a few of my NRI friends who actually gave their steps during med school. I think that's probably the best time to study because you have a lot of time in your hands and you're kind of studying the same subject. So if you know what you're doing in terms of what you need to study, then it's more easier to give the steps during your first and second year. But the catch is that the way you study for your university exams should be completely different from the way you would study for a USMLE. For your university exams, and I'm not sure if you guys still do the same, but then we all had a bunch of questions that we could follow based on like the last 10, 15 years of university exams or whatnot. So there were certain topics you could get away with not studying. But the USMLE is all a multiple choice question. So it's like an 8-hour exam where you have multiple blocks. So you cannot leave out a single subject, say, I don't want to learn about the optic nerve, or I don't want to learn about the biochemistry of certain compounds. I think you're forced to learn all the compounds at all components of medical school because you could have various questions pop up on it. So that would be the only catch, that your method by which you study would be completely different. So if you want to, then you definitely can, and you're kind of studying the same subjects, and sometimes studying for the USMLEs is a lot easier than studying for our university boards. They are very practical in terms of being able to, in terms of the questions they ask, the material that they want us to know. And sometimes studying for the steps might make studying for the universities easier. Again, it's all a matter of everybody's different method of studying and so on. So if you can, during med school. If you can't, do it later. What I did was we joined the Kaplan courses when I was in med school. So I think it helped me with my university, even though I didn't take my steps.
Okay, that's great, sir. So what about observership? So I'm not sure if everybody's aware that observership is different from an externship. In fact, I recently wasn't aware of that either until very recent. So what is this difference, and which is best opted for medical professionals?
So an observership is where you observe a certain medical practice in whichever setting, in the capability of just being an observer. And that's all that word means. So, you're just an observer. Your input on medical decisions are minimal. Your interaction with patients are minimal. And as you can imagine, there's a huge amount of liability involved when you're putting a foreign medical student, even a medical student, inside a patient's room. Like the patient could, it doesn't happen that often, but there are case scenarios of patients suing the hospital system just based on certain inappropriate comments, or, the observer leaking certain medical information. Like, say, for example, one story that I heard recently was that there was this patient who had a real oncological illness. He had like some type of rare lung cancer. And this observer was talking about that case in the cafeteria with another resident or an observer, and the observer mentioned the patient's name and so on. So one of the patient's family members overheard them. There was a case against the institution, and then the institution closed all observers for a year. So you can imagine what the institution is worried about when they want to get you an observership. But an observership means that you're here only on the purpose of observing, or, witnessing what happens in the medical system, trying to get to know things. And from my personal experience as an observer, you are not able to comment on any process in the, like, for example, nobody's going to ask you, how would you treat this patient? No one's going to ask you what is your medical diagnosis, or what is your clinical impression of this. But what could happen is that when you're walking across the hallway and the attendings, maybe one in a long day, he might turn around and ask you, what is your opinion? And that is the time you have to impress on the attending that you've understood the basics of medicine, and that your thought process or your deductive reasoning is intact. They're not expecting you to walk up there and tell them, oh, this is a type 2 MI, and I'm going to treat them with aspirin and statin, and I'll put them on a heparin sip. That's not what they're expecting you. The expectations from you are purely from a professional standpoint, as in, are you courteous to everyone that you meet? Are you respectful to people around you, especially around the patients? Are you able to demonstrate a line of reasoning or deductive process where you're able to demonstrate that, yes, I'm able to meet a problem and come up with a solution in a reasoned pathway? Now, the difference between an observership and an externship is that anybody can be an observer. You do not have to be a medical school graduate to be an observer. We have high school students here who observe to see what it means to be a physician. We have undergraduate students. We have graduate students. We have people who are PhDs working in the lab trying to gain some clinical experience into the disease that you're working on. For example, my last research here was focused on the gut microbiome and CAR T therapy, which is a type of adaptive cellular therapy. So we had physicians from the lab, so physician scientists who have nothing to do with clinical medicine, come with us to clinic to see what exactly a patient who's treated with CAR T undergoes. So an observership is a very broad definition given to a bunch of people, and the way that they can assess you is very limited. But contrast that to an externship, which is even more elaborate. So an externship is done or granted before you graduate from medical school. And if you get an externship, you're considered as an external medical student that's here. So you're able to interact with the patients a lot more. You're able to examine the patients, present your case to the attendings, make a clinical impression, and so on. So the amount of experience you gain from an externship is vastly
Much more.
better from an experience you would gain from an observership. And also the amount of time and quality of material that they would have to evaluate you is better during an externship. And hence, for all these reasons, externships are still valued far more greatly than an observership. Externships are a little bit more harder to get for the same reason. And externships are only granted before you graduate from medical school. There are lots of concerns about delaying your graduation in medical school by joining an externship. Should you graduate with your class or graduate later? My advice would be focus on trying to get an externship if you can. That will be of very good importance in your USMLE application. But all this being said and done, it also matters why you're doing an externship or an observership. So there are a lot of paid externships in clinics, and that really doesn't count as a true externship. If you're looking for a true externship, what I would ask you guys to do is to look up universities like University of Maryland, the University of Houston, and all of that. Now, again, with COVID, things have changed, and there's a lot of animosity towards getting people from an unknown environment into the hospital. But if you truly are looking at an externship, then you should look at big universities or academic hospital settings where you truly have the opportunity of being a medical student and learning along with other medical students, such as American grads. Whereas all these paid externships that you get to do rotations in clinics really doesn't count as a true externship. So in that instance, being an observer in an academic institution would be better than an externship. So you have to take the context of which place you're doing these observerships, but then if you can, then it's always better to do an externship than an observership.
Okay, that was very well explained, sir. Thank you. Another question most aspirants have in mind is, how do I create a CV that stands out from the rest of the crowd? And in this process, how do I hone my scholastic and my social skills?
So you have to realize that when you're applying for the USMLEs, you're kind of always starting the analogy that I liked when I was trying to do the USMLEs was an analogy where think about everyone running a 500-meter marathon, and you were starting at least half an hour late behind an American grad. So as far as an institution is concerned, when they want to hire, say, for example, my residency had 20 internal medicine and then I think 8 prelims. So say 30 candidates that they have to recruit for a residency season. It's much more easier and safer for them to deal with a student that's from their own university. So the first priority would be for a student that's graduated from their university. Each university medical school has to have a certain amount of residency ranking in order to be successful, and there's an understanding between both of them to make sure that their priority is given to in-house candidates. And that's not a political reason behind it or anything, but that's kind of like how it is because that's how it's supposed to be. Yeah. Because otherwise nobody else would join medical school. So your first priority is for in-house university candidates. So your second priority would be for people who are in the same system. So in the American healthcare system. And that's because they've been in the system, they know how it works, and there are methods by which they can judge how this candidate is in terms of letters of recommendation or whatnot. Say, for example, my professor in University of Oklahoma knew my section chief in hematology oncology fellowship at Baylor, and so they were like, oh, if that person is recommending him, I'll interview him. So they get 3,000 applications for a 30-spot university position, and so then they have to filter out in some means. So they always filter out in ways of how do we know this guy? Is this guy good? And then so when it comes to your international medical graduate, then it is a guy or girl who they don't know where they're from. They don't know how big University of Ramachandra is, or they don't know how big University of some other Manipal University or MMC or KMC. They don't know what that means. All that they know is that this is a medical school across the ocean, and not everybody has the same understanding of what India is to everybody else. Some people have a deeper understanding of how good the medical system is. Some people have a very superficial understanding, thinking that it's all, there's no literacy over there or whatnot. So when they're looking at a candidate, they want to know, is this guy dependable in terms of both an academic, professional, and social standpoint? So you have to try to do everything that you can to make yourself stand out from those 3,000 applications. But at the same time, you have to realize that these are people who are doing this year in, year out. So if you think about the life cycle of a program director in a year, July, she gets new candidates, new interns to train. And then September, they start receiving applications for new interns and they interview them in December. They finalize their mark list in March, and then they're doing this again in July, August, right? So they've seen a countless number of applications, and it's very easy for them to tell which are honest, which are made up, and which are a sincere attempt at being honest, and which are falsified. So what I would suggest is like always be honest in your resume. Do not try to make up stuff that you have not done. That's rule number one. Whatever you have accomplished so far is probably good enough, and you guys have done a whole lot to get into medical school. And if you're motivated enough to travel across the ocean to apply in the United States system, again, you're more motivated than a lot of other people in India. So do not make up stuff on your CV. But then if you're focusing on developing your CV, one part of it has to be academic in terms of, what are your USMLE scores and how's your academic performance in medical school. And that's going to impact the letters of recommendation that your professors or your dean from your university is going to give you. The second part is going to be research. And research would be clinical research. Have you been part of, posters, case presentations, abstracts that you've submitted at local meetings, international meetings if you can. Now, our opportunities for presenting research are low, and people know that. When I went into residency, I had a couple of posters and abstracts, but I didn't have any publications. So it's not that if you don't have a publication, you won't match. But at the same time, if you have one, then that's great because that sets you apart. So shoot for journals in India that your institution has a publication track record with. You can always shoot for case reports or something like that. Try to participate in conferences around you. Try to win some scholastic awards and so on. And so that's one part. The second thing that they also want to know is that they are not hiring a person who's a bookworm. They want to hire a person. So they're interested in you as in your interests. What are your social interests in? So if you're able to demonstrate any extracurricular activities, that is also a plus. And I would always encourage all of you to put in some extracurricular activities when you're building your resume in the ERAS portal, which is the portal you apply for residency in. So that being said, the third most important part I would say is that social activities make a huge difference. So you are in a place where there are issues around you that you can easily address in your university, in your medical campus. So if you're able to demonstrate a social activity, and the reason that they want a social activity being, or the reason they prefer something like this is not because they want to know that you're kind-hearted or you're good-hearted or not. The reason why this is valued is because, one, you're able to identify a problem. Two, you're able to come up with a solution. And the most important, three, you're able to implement that solution and make a difference. So then that, tells us that this candidate is the person who is aware of the socioeconomical ramifications around him, or, the disparities around him and what that impact is. And then he's able to identify a problem, come up with a solution, and be able to implement the solution by navigating the healthcare system he is in, which not only demonstrates your willingness to learn, but it also demonstrates your potential that you're able to adapt as a team player and make a difference. So that is a big importance. So if you're doing it, then that obviously helps. But again, I would say this with true honesty is that if you truly want to do something like that, it's a huge amount of work. It takes a lot of your time. And if you're not interested in doing something like that, I would not do something like that just for your CV. There are other ways you can build your CV, and really this might make a difference, this might not. So if you are interested, do it. It's good for everybody around you. It's good for your institution. It's good for you too. But if you're just not that kind of a person, I would not do that just to build my CV. That's not the one thing that's going to get you into residency. So if you truly are not interested in that, then focus on the other stuff that we spoke about.
Okay, that's great. So just as we were talking about CVs and skills, we also hear that you were a part of the editorial team of quite a few newsletters and magazines. So how would you describe your experience and how has it been beneficial for you?
So I think that's something that we spoke about. So I was, again, it's not a big time newsletter or something, but it was our college editorial that was there in Ramachandra during our university here. I was editor-in-chief, and then one of my friends had another newsletter that their dad had a newsletter. So they were looking for someone to edit. So then I said, I'll do all these stuff that's not related to medicine in medical school. So I did then. But the advantage is that when you do stuff like this brings about certain other skills that you have that you're able to demonstrate and put on your resume. I was debating a lot about putting this on my resume because one, this is a newsletter down that's once a year and nobody ever knows about. And again, the other newsletter was a company associated newsletter that has nothing to do with my medicine. But I put it in there anyways because I wanted to fill up some space. I got an interview for residency in Chicago, and one of the big things that the program director was talking about was that they had a pet project of publishing something related to medicine, and they were looking for a person who would be an editor. So again, this is an example of how something that's totally unrelated to medicine, that's not related to your scores and whatnot, but that sets you apart because that institution is looking for someone with that specific skill set. Whether you're able to demonstrate that you are able to continue that skill set doesn't matter. I didn't match there, but I still spoke with that professor a couple of times and he asked me a couple of questions. I didn't do anything more than just giving my input, but that might make a huge difference. So small stuff like this, it can add to your resume. So when you're typing your resume, I would add everything that you've done. Even if you think that this is very insignificant, I would put it there because for some person somewhere, it might be significant enough.
Yes, absolutely, sir. So as we talk about CVs and interviews, what is your take on attending interviews? And would you say that they were pleasant memories or rather taunting ones?
I think, it's a different experience. You've never been interviewed in your life, and then all of a sudden you're being interviewed, and it's kind of like, different cuisines is what I would think. I interviewed at quite a bunch of places for residency and fellowship. For residency, I interviewed more than 17 places. For fellowship, I think it was like 24 or something. So it's a good experience. I've always enjoyed the experience because you change your perception of the program and the perception of people around you. Residency is a tough process, but it's nowhere as tough as doing residency in India. I still think compared to residency in India, this is much more easier. But you want to get a feel of what the program is, what the people around you are, and, can you trust these people? Can you go into them with a problem or whatnot? So coming to the fellowship process per se, I really liked it. The interview process, sorry. It was a different experience. Everybody's different. Certain people just want you to talk. Certain people have a set of questions that they want you to talk. But one point that I would make for all of you is that interview process are different. You've not been there, but at the same time, you don't have to be nervous about anything. You can be pretty casual. You can try to be yourself, and they want to see. At the end of the day, they know who you are before you walk in. They know what your grades are. They know what to expect of you when you come in. But what they're truly trying to understand is that, is this a person who I would feel comfortable talking to or waking up in the middle of the night at like 3 a.m. or 4 a.m. and asking him to do something? Or if he calls me in the middle of the night with a question, is this a guy I would be comfortable around? Or am I okay spending my whole day around this guy? So they want to make sure that you are an affirmable person and make sure that you're a good team player. So I would not make up stuff, and I would not be. It's easy to say don't be nervous, but try to be yourself. You don't have to use any great vocabulary. Just use the vocabulary that you're comfortable with, and have a conversation instead of giving a direct answer. And it's easy to steer the conversation towards where you want it, but I would also not focus on diverting the conversation to here and there and stuff. Like, for example, I've read a lot of blogs about divert the conversation towards a specific thing that you've done, divert the conversation towards your accomplishment so that you can talk about it. The interviewers are people who have been interviewing for years, and they can know when you're trying to be artificial. They can know when you're false. They can know when you're making stuff up, and it's very easy to get that impression from you, and that's a bad impression, and that's a bad place to start. So rather just go with the flow of what the interviewer wants. Talk to them and say, at the end, if you think there's a highlight on your resume that you haven't heard, then you could always just, hey, I just wanted to bring this up, but this is something that I'm really proud of. But I wanted to see if you had any questions. I know you might have read it on my CV or whatnot. So that's something to think about. But overall, it's definitely not daunting. Remember that if you've landed an interview, remember that everybody there at the interview are on the same footing as you. So it doesn't matter if the guy who you interview with, if the co-interview is one's from Mayo, one's from Harvard, it doesn't matter, right? Even though you're from Ramchandra, you're sitting there because those guys from Mayo and Harvard are about the same as you are. So at that point, I wouldn't get intimidated by people around you. Realize that the program really wants you to be in their program. And that's the reason why they're spending so much money and effort in trying to get you there. And that should give you a level of confidence saying that, okay, now I have to decide if I want to be in this program or not. So don't feel shy about asking questions that you would want to ask, but at the same time, I wouldn't walk in there asking them, hey, how much vacation am I having? Or, how busy is your call schedule? Would I get time off in the night and stuff like that? Remember that ACGME, the American College of Graduate Medical Education, has certain laws by which all programs have to abide by. Interns that cannot work more than 24 hours straight. So when I was an intern, I think it was 24 hours, and now I think it's just like 18 hours or something. So you cannot work more than 18 hours straight. You have to have 3 weeks off in a calendar year. So these are all things that the ACGME will take care of you, and you don't have to worry about asking your interviewer if this would happen. So then it just gives a different vibe of like, hey, is this person a guy who's worried about working or not? So one thing that I always brought up whenever people ask me, are you intimidated by the American healthcare system, is that the amount of patients that you've seen in the Indian healthcare system is far, far more superior than the amount of patients that you'll see in the American healthcare system. So that should give you a confidence in itself, saying that you can handle stuff. But here you have other documentation stuff and insurance stuff that you might have to deal with. So that might be a tricky part to navigate, but you have the experience to get through this. And countless number of people, including me, have done it. So you'll be able to do it.
So at the end of the day, when terms of interview, it's all about walking in with confidence and just being yourself and hoping for the best. Next up, Doctor. Yeah. So next up, Doctor, something that we want to know is the counseling and the allotment process. How different is it from that of India? And I think you mentioned something about an NRMP process earlier. So what is this entirely about? And is there a provision for us to choose a university of our choice?
So in India, it's pretty straightforward, right? You get ranked number one, and then it's your pick. You get to decide which one you want. In the US, it's a little bit different. So in order to be eligible to apply for residency, you'll have that USMLE step 1, step 2, and all the certification process that you go through in order to be able to submit your rank list. So how the process works is that around September, I think it was September 15, or I think it is September 15, the match opens. They call this residency process or this whole PG allotment process the match. And that has internal medicine, surgery, all the other specialties that you can think of. On September 15th, the match opens, and you can register for the match, and you can apply to programs. Applications for the programs requires a personal statement, letters of recommendation, your mark list, and then your resume, and then your transcripts from medical school. The personal statement, I think, is something we haven't spoken about, but that's also a very important process. It's a 1-page document saying, this is the reason why I want to come to the United States. This is the reason why I want to do internal medicine. And this is the reason why I want to do internal medicine in your institution. So that would be a summary of your accomplishments, your career so far, your trajectory that's brought you here to the United States. So you have to make it clear, succinct, and kind of give the impression to the reader that this is a guy who is articulate, who's able to demonstrate a strong interest in whichever career path he's chosen, whether be it internal medicine or surgery, and then also be able to demonstrate that he's acquired skill sets, he's demonstrated, a thoughtful mind of identifying his deficiencies, and he is trying to accomplish this. So that would be another 1-hour discussion of how to write a personal statement, but that's an important part of the application. But personal statements are stuff that we've never written before, so try to write them on your own. And remember, do not ask some other people to write your personal statement. You can ask for input, but write your own personal statement because it is your personal statement, and people will question you on that. So once you have all these documents ready, then you apply for the match process in September 15. And then you start getting your interviews sometime October, November, and then you can schedule your interviews and you go interview. So once you've interviewed, you have a list of places that you interviewed. Say, for example, I interviewed place 1, place 2, and then all the way to place 15. Say, just for this conversation, we'll say I interviewed at 5 places. And then after that, in February, you have to submit a rank list. So I can say, for example, University of Oklahoma is number 1, University of Kansas is number 2, Baylor College of Medicine is number 3, some SRMC is 4, and MC is 5, some random order. And then you submit your rank list, and then this rank list is taken into a computer algorithm, which is very, very complex. And the people who designed this algorithm actually won the Nobel Prize for the algorithm. So you can imagine how complex that algorithm is. And then by March, you get a notification saying you've matched. And then a week later, you find out where you matched. So how this process works, simply put, is that you are able to submit a rank order preference list. Or in other words, I can say my first preference is this, second preference, third, and fourth, and fifth. And then you are assigned a spot. You don't get to say, oh, if they assign you University of Houston, I can't go back to them and tell them, hey, I picked University of Oklahoma 1, I don't want to go there. Okay. And you have when you submit the match, you have a binding agreement saying that I will make sure that all the places that I rank are places that I will go to. So if you do not like a program per se, or you cannot imagine being in a specific program, then I would not rank that program at all. Then I would stop at rank 1, rank 2, rank 3, and rank 4, and then not rank the 5th place at all. Because then you don't have to be worried about going to that place, because if you do match there, you have to make sure you go there. That's number 1. How the rank order list works is a little bit more different. So how it works is that each candidate is able to submit a rank order list, and each program is able to submit a rank order list. And the preference is given to your candidate. So bottom line is, if you like a program, and you don't have to be worried about if they're ranking you high or if they're ranking you low. You just have to rank based on your personal preference and whatever you think is best for you. You don't have to worry about the other side. But in order to understand how it works, is that we'll take this example of these 5 spots that I've ranked. Say my first preference was University of Oklahoma. So then the match will go into the University of Algorithms rank list. University of Oklahoma has 30 spots. So look and see if the first 30 spots has my name. If the first 30 rank list that the university has ranked has my name, that's where I match, and that's end of my match algorithm for me. But say, for example, I have my rank list that university provided was 40 instead of 30. So then I'm put on hold. I am possibly in the University of Oklahoma's rank, but I'm not confirmed there yet. So then it will put me on hold, and then it would go down the university algorithms rank list and say, for example, rank 1 to 30. If there is a candidate, say, for example, the last 10 candidates have ranked other institutions above Oklahoma, and they have matched into those spots, then those 10 spots have been removed from the Oklahoma rank list. So my rank, which was previously 40, now becomes 30, and then I match into Oklahoma. But if, say, for example, my rank at 40 stays at 40, or University of Oklahoma did not rank me, then it goes to my second preference, which I don't know what I said, but maybe Kansas. But so then it goes to Kansas University, and then it goes through that same process again. If I'm in the top 5 spots, all the spots that they have, then I match. If not, I'm on the wait list, and it waits till that list is done. And if I move into the confirmed list for Kansas, I match at Kansas. If not, I'm again put on hold. And if I don't match, then it goes to my priority number 3. So a simple way of remembering it is you get to pick which place you want to. If you do not want to go to a certain residency spot, then do not rank that place, and then worry about it for the rest of your life. So if you are confident that you'll be okay in all these different spots, then you can rank them, and then you'll find out. But that's a simple way of explaining how the system works, and I don't know if I did a good job, but that's my understanding of how the match works.
No, that was very well elucidated, sir. I think there's no other more simple way to have said that. So that was great, sir. And now, Anji, sir, what we want to ask you is, what are the alternate pathways to turn to, if not for the United States?
So when I did my USMLE, I was worried that, the big what if you don't match. The USMLE, preparing for the MLEs itself is a big investment, both in terms of financially, emotionally, and also academically. You're spending a year of your time preparing for the MLEs, taking your MLEs, and you're spending another good portion of the year going to the US, getting observerships, paying money out of your pocket for these observerships, paying for these costly exams. And then you have this whole process of interviews, not knowing how you did an interview, and then this match list and this complicated match algorithm. So my big concern was, what if I don't match? It's going to take me another 2 years to be able to go and prepare for an Indian exam that all my friends did, and understand that the way you prepare for the United States exam is completely different from the way you prepare for exams in India. So what I did was look at pathways where the same USMLE process would be valid. So I started looking at countries that would take USMLEs, and say, for example, things that I did was I took my Australian Medical Council licensing exam and I cleared that. So my backup plan was that if my USMLE pathway doesn't work, then I'll probably go to Australia to try and see if I could do residency there. You could try to look at the UK system and see how possible that is. Remember, there are multiple ways you can enter other systems, but at the same time, I don't think I would try to focus my career goals into one. So I gave my step 2 before my step 1. And then when I gave my step 2, I gave my Australian exam. And then when I scored well, then I was kind of like, okay, let me go through this process and see what happens. And if you're ECFMG certified, then that certificate is still valid in other countries like New Zealand and Australia, and you can pursue residency options there too. So it's important to identify other pathways, but at the same time, don't try to shoot for everything. Try to narrow down your goals in one and pursue your interest in one, but always have a backup plan of saying, if this doesn't work, what's an alternative?
What's next?
I think a more reasonable alternative would be, if you can't take other exams, is to try and see if you can get into a master's of research, like a master's in epidemiology, a master's in clinical translational health, a master's in public health, or something like that, which would get you time in the US to get to know the system. You'd get an American degree, so you're not wasting your time. You can establish contacts, you can work on some research, and you can reach out to other people saying, hey, I'm doing this master's that's a year long, and I'm interested in research. Is there a project I can work on with you? My eventual goal is, going into residency. Mm-hmm. So if you're going through that, then I would be very clear with what I want, and what I reach out to people with is that I would reach out to people telling them, my goal is to become a resident here in internal medicine, and I'm doing this purpose to gain experience to do that. I would not, not tell that and then give a different kind of implication to people that you're collaborating with. Honesty is always appreciated everywhere, and also here in the United States. If you tell them this is what I want, they will be able to tell you, hey, this really won't work out for you, or they'll tell, don't waste your year on this, or they'll tell you, this might work, but I'm not sure. Let me see what happens. And once they know that you're a candidate who's really working hard, they'll try to find venues to help you. So apart from the USMLE, if there are delays, or if you don't match the first time, then you could identify like research parts or something like that, where you can work in the US for a year or two to try to gain that experience and then convert it into residency. Not everybody matches the first time, and not everybody who doesn't match remain unmatched forever. I've known people who haven't matched for 3 years and then have matched. And remember, it's a complete package, so your scores are just one part of the package.
Okay, that's great. That's great news for people who are scared about what next, what happens if they don't clear. So now that you've been in the American setup, what do you think, or would you say that the American setup is better than the Indian medical faculties?
I think you'll be comparing apples to oranges over here. And I think, everybody's biased. I'm biased towards the American healthcare system because I was here. But I think both systems are great. There are unique advantages and disadvantages to both of them. I know physicians and mentors who were great people back home. I've had great mentors back home, and that's why I'm here. And then I've had great mentors over here as well. So I would never tell anyone that the American healthcare system is better than the Indian healthcare system, or tell anyone that the Indian healthcare system is better than the American one. All I would tell you is that everybody is different, and everybody has different takes on what's important to them and whatnot. So if you identify what your personal preference is, then you have to stick with that. At the end of my medical school, I knew I wanted to do HEMONC, and I knew that I wanted to do HEMONC here. So if you're able to identify a reason why you should come here, then that's good enough. That reason should not be that everything across the ocean is good, everything that comes from America is world-class or standard, and that's not true. There are crappy residency programs in the United States where the level of training that you will get is far more inferior to what you'll get in India. The clinical skills that you come with from India are far more superior to what clinical skills from graduates get from over here. But again, you have to take that into context. It's not because they get inferior training, it's because they have better tools at looking at stuff. My final year university internal medicine exam was like to find out which level my hydropneumothorax was at, and whether it's at the fifth intercostal space or whatnot. Identify that it's hydro and pneumo, and then what level. But that skill is practically useless at this point, because every patient that walks into me in clinic over here either has an X-ray or a CAT scan.
Yeah.
And I'd say CAT scan is more than an X-ray. So that skill set that you obtain in the Indian healthcare system is not translated to being a useful skill set in the American healthcare system. So if I walk into the American healthcare system and tell them that, hey, I have this skill set, so I'm superior to you, then that's an idiotic thing to say. So again, don't compare healthcare systems, apples to oranges. And what I can give instead is that I can give a biased take on the American healthcare system. And I think it's a phenomenal system to work in and train in, especially. Everybody's motivated to make you learn. Everybody's motivated to make sure that your life is happy, and that they don't want to overburden you, that are set laws. You're not working 24/7. You get financially compensated for that. Your stipend is, you're not going to be traveling in Mercs and BMWs, but still you'll be able to afford a lifestyle that would be unaffordable on an Indian stipend for sure. The biggest point would be the mentors and the faculty and the teaching environment that it portrays, and the skills that you have. So for certain fellowships that you think might not be possible if you're in India, is possible over here. Research is definitely a big deal over here, and you're able to understand a lot more about what it means to do research over here than over there, because the way that the American healthcare system is able to divert the resources are far more different than the way the Indian healthcare needs to. Again, it's not that there are no flaws over here. There are a lot of flaws. Medicines cost a lot. People who are not insured have a lot of issues, but there are safety nets, and most of the residency programs operate in the safety net. So you're able to treat patients who have insurance, who don't have insurance, and so on. So there are ways to overcome difficulties anywhere, and there are ways for you to shine wherever you are. I know a couple of my med school buddies are doing really phenomenal back in India. I know people over here who are doing really phenomenal as well. So you have to pick what's best for you, and do not judge systems from outside. Get inside them and then find out the flaws and whatnot. But overall, I can give you like 10 different examples of why this American healthcare system is great. I can give you examples of big section chiefs being so humble, but that's not the point of this discussion. The overall discussion would be that both are unique, advantages, disadvantages to both, and you have to find where you fit.
Absolutely. So before we proceed, I have a few people sending in a few questions. So to you people, we're almost done with our first part of the session, and we'll go ahead and take your questions. And that is, sir will take your questions right away. So, so you mentioned that your field of expertise is hematology and oncology. So what was the driving factor to choose this field?
My mentor was, I don't know if most of you know him, but my mentor was a pediatric hematology oncologist. So his name is Dr. Julius Xavier Scott, and I did my first pediatric internship month with him. So that was my first experience to hemonc, and I kind of like the field where it goes. And in internal medicine at the University of Oklahoma, we have a dedicated cancer center like most universities. So then there was a lot of more exposure to hemonc. So that solidified my interest in hemonc. My whole career is based on hemonc, so I can talk for a long time, but I'm not going to do that. But what I would rather tell you is that, mentors make a huge difference. Having the right mentor in the right place will take you in a different trajectory wherever you are. As an example, my mentor, this pediatric hemonc mentor had this idea of starting a foundation for children with hematological oncological disorders in India. So then it was his idea, but then me and my friend did it. His name is Guhan. So we started a foundation. We started doing stuff. It's still running in Ramchandra and stuff.
Yeah.
But so that was something that I did just because my mentor liked it, and I thought that would be a good thing to do, without realizing the implications it would have on when I applied for residency. So even now, when I interviewed for an assistant professor job, there are people who ask me, how's MedHope doing? Or what do you do in MedHope and so on. So small things that you do without thinking about, the residency process really makes a big difference. In contrast, things that I did thinking that it would make a big difference on my CV for my residency application was never brought up.
So about MedHope, I think Ramachandra is still continuing to have a good course, or rather a good outreach with MedHope as such. And right, okay. So I think we'll have around two more questions. So the first one being that is the fact that many people are apprehensive to even apply for the USMLE. And this is just because of the expenditure involved in the entire process. So roughly how much do you think would be the overall expense while attempting?
I think that's a good point. It is an expensive process, but you're kind of paying upfront for it. I think each exam is around, if I remember right, like 1,200 to 1,300. So maybe around, so for all the three exams would be $4,000 or $3,500 or so on. Remember, for the last exam, you have to travel here. And then if you're doing an observership, then you're living on your own and so on. So that would mean little bit more money as well. So I actually made a PDF of how much my expenses were. And if I'm remembering it right, I think just to get certified, I had to spend around $4,000 or $5,000. Again, this is 7 years ago. And then during residency, you have to travel to all these residency spots and what interviews and whatnot. So that process, I think overall, I ended up spending around $11,000 or $12,000. And again, that's a number that's very unique to me. Like if I do the interview process again and I do it in a different way, then I won't spend the same amount. So during fellowship, when I interviewed, then I had to spend a lot more because then I didn't have time to take the bus somewhere. I just flew. I drove my own car. So, things change. But the point I would make rather is that whatever you're spending up front. And even though I spend 10 grand or 12 grand, whatever X amount of money up front, for the remainder of my training, for the last 6 years that I've been in training, I've been financially independent. I've been able to survive on a stipend. I've been able to, raise a family. I have 2 kids. I have a dog. I can afford all of that on a stipend that I get here in the United States. I don't think that would be feasible to a huge extent if you're getting a stipend by doing a postgraduate course in India. So the way I would compare it is that you're paying a lot more money, but then you're also getting, financially compensated for all the work that you do once you match inside. The big question that lots of people have is like, I spend this amount of money, but what if I don't match? But I think you always have to be optimistic, and you can always try to figure out a way to get inside. So I wouldn't worry about that part too much if you can afford it, for sure.
Yeah. I think that was very beautifully said by Sir, that whatever you invest now would eventually pay off in the future. So the last question from our side today for you, Sir, is we have now come to hear that starting Jan 2022, step 1 is going to be a pass-fail exam. So that rather than a score-based one. So does that place us foreign applicants at a greater advantage, or does it pull down our chances of clearing?
I don't think it would definitely sway one way or the other. So I would look at it in 2 ways. Look at 2 candidates. One candidate who has scored really well in step 1, and another candidate who has not scored well in step 1, but has passed. So for the candidate who has scored really well in step 1, really now has a tough time proving that he's different from the other candidates. Whereas the guy who scored bad in step 1 now still has a good shot of making the process. So advantages and disadvantages to anything that you take in life. But what, again, it would emphasize is that scores are just one part of your application. And it doesn't matter if at one point the USMLE was scored in a 2-digit score, and anybody who got a 99 was given a residency spot, period. You don't have to do anything else. And then people realized that 99 actually meant a score from 230 to 260. So people who were 265 and advanced still weren't able to match. So the scoring system would be one part of the application process. Again, like I would like to reiterate. But advantages would be that if you don't have a really good step 1 score, now you just pass and you'll be fine. But how the universities filter your application is also different. So this is true. When 3,000 applications go into a residency program, they have to filter out a way to select 300 candidates that they would interview for the 30 spots. So remember, they interview usually on a 1:10 or 1:12 ratio. So for 30 spots, they would interview 300 or 400 candidates. And then for the number of applications that they would get would be 3,000 to 4,000, right? So how they filter out is based on USMLE scores. So they initially have a filter by saying, if you are anyone above a 240, I will look at their application first. It doesn't mean that they will interview everyone above 240, but that's just a foot to get inside the door, and then they'll say, then that's when they open your application to take a look at it. So previously, people whose scores were lower than 240 wouldn't be able to even get through that first checkpoint. But now, if it's just a pass or fail, everybody gets into that checkpoint. Yeah. So what the university is going to do then is that it's going to find an alternative checkpoint. They're going to say step 2 score of this much, or they're going to say these many accomplishments, or these many research publications, or whatever that they can think of. Some measure that they can judge everyone based on is going to be used as a checkpoint at some point, because that there has to be a way they can cut down the 3,000 to 30, and that's where personal recommendation comes in. So if you have a letter of recommendation from the same university, then they're like, hey, this is somebody from our university vouches for, so let's take a look at that guy or that girl. So that's where a difference would happen.
So it's not just the score, but everything put together. All right, sir. So with that, we have come to the end of the first part of our session. So we will now be taking a break, after which Pawan and I will be directing the questions sent by the audience to sir. Note to the audience, please feel free to leave your queries in the chat box, and we will read them out to sir in an orderly fashion. We wish to ensure that we tend to all your queries, and so we shall be trying to combine a few related questions to accommodate as many as possible in the given time. Thank you, sir. And now over to Pawan.
Yeah, thank you, Nikita. So, guys, we just thought to explain you what is actually the professionals. So, next slide. Yeah. We, the team of been working consistently to bring out free webinars on important topics in the medical world. So, our only motive is to provide free medical knowledge to all. So, we don't not only do the webinars, we also make weekly newsletters. We also make medical cartoons and then MCQs, mnemonics, and medical contents, notes, and lot more stuff for there and professionals. So the newsletter, when it comes to newsletter, we just have various columns. So it's from the medical updates. You can see the medical facts, and then we even take the inspiring medical students and then add it up in our newsletters. And then even the professors have been given their content, and then there's topics over the recent topics and all. So this is the segment of our cartoons and mnemonics, which you can see in our Instagram. And then when it comes to webinars, till now we have been conducted more than 30 webinars. And then I guess this is the 31st webinar. We have faculties over various departments. So you could see few of the webinars posters have been displayed. So I think, yeah. And then next, we'd like to tell about our professional psychiatry faculty. Dr. Arthanari is a psychiatrist who's working as associate professor in Meenakshi Medical College. And then he's currently now started a page called Beardo Stink and Instagram. So guys can kindly check it out, because he's also made a free consultation for medical students. So kindly do check his Instagram. And then now it comes to the future plans of professionals. So we are planning to conduct medical health camps, workshops, online events, and a lot more interesting stuff for the medical students. So if you want to know more about us, and then you want to be part of volunteering these medical workshops, everything, you just kindly visit our Instagram page or kindly text me. My number is visible there, like it's 770-8787-833. So you can contact me, or you can just approach our Instagram page. So if you want to be part of our team, or would you like to view our future events? Okay, that's all. Now I would like to welcome Dr. Atna sir to give his speech.
Very good afternoon to one of present here. For the ones who do not know me, I'm Dr. Arthanari Manikvasikam. I would like to start by saying huge thanks to Dr. Adan Manji, who very readily accepted without giving a second thought for making this wonderful event happen. Thanks a lot. I have two announcements to make today. One is that we are planning our next webinar, which we are planning to make it like a Instagram live, which will be in my page, which is the Weirdo String. The topic would be the impact of social media influences over young minds today. We come across a lot of youngsters are getting into a lot of trouble because of the recent lockdowns and increased screen time that they are spending in mobile phones and through internet. We feel that
Okay.
a lot of people are getting demotivated, or they are getting motivated in the wrong way that they are not supposed to, because of the influencers that do not lead them in the right way. So we are planning to do one webinar on that. And the second information would be that we are also planning to conduct a small student-based research study, which will be prevalence of anxiety disorder among medical students during this COVID-19 pandemic. Uh, the Google Forms will be sent to individual participants. Whoever wants to volunteer can participate in the study. I would like to thank Pawan and his team for organizing this wonderful event. Once again, I would like to extend my gratitude to Dr. Adan Manji. Thanks a lot. Have a good day.
Thank you, sir. Thank you so much. And then, guys, you can check it out the chat box. The link for the study have been posted. And then I think we can continue with our doubt session. So if you have any doubts regarding the USMLE and then towards the Adam Master, please kindly put it up so that me and Nikita can address for you.
I think I have a question in my chat. The question is
Okay.
like, could we lock the MLE score we get in med school and then do PG in India and later on do a fellowship or something in the US? Does that work? It's a good question, and I think it does. So, as I was a chief fellow in my fellowship, so at Baylor, I interviewed fellowship candidates last year, and one of the candidates that I interviewed was a guy from India who did his med school in India, and then he did his internal medicine, or medicine postgraduate, and then he did his hem-onc fellowship at Tata Cancer Center, and then he did a year of research in the US, and then he was applying he did another internal medicine residency at Mayo, and then he was applying for fellowship. So, there are people that are motivated enough to go through the whole process again. I know a med school colleague of mine who did his surgery training in India, and then he's done his transplant hepatology fellowship here in the US, and now he's an attending at University of Miami. So it is possible, and you can. But if you have to do some sort of residency training or something like that here, then you do have to take your MLE. So whether you take it now or you take it after your postgraduate training,
Okay.
that's your call.
Okay, so we have a few doubts that have come in. Pooja asks about some study methods that Sir could suggest while preparing for the USMLE.
I think study methods is something that's very, very unique to everyone. Everybody studies differently. And my one study method or advice that I've given to anybody who's asked me is that do not read blogs and do not get advice from anybody else on how to study.
Yeah.
You've been through medical school. You've got here so far. You know how to study. That's not the question, right? The question really, I think what you're trying to ask is, what should I study at? And I think it depends on what time you have. So another advice that I've given is that do not set a timeline for your exam and then start studying. Study and then give your exam whenever you think you're comfortable enough. Like, my goal was not to finish and apply this September. My goal was to finish my exam, and then if it's before September, I apply this September. If not, I apply the next September. But realize that if you're delaying it by a year, you have to have something to fill on your CV.
Mm-hmm.
So if you have a gap from medical school for a year, you need to fill that up in your CV. You can't tell them that I was just sitting at home and studying. So working part-time, working in a facility or a spot that's not too demanding, that's probably enough.
Okay.
Yeah. And Pawan, do you want to go ahead with the next question, or?
Yeah, you can go. Yeah, you can proceed.
I'll do it. Okay, fine. So we have somebody who has asked how not to over talk in interviews and get yourself into trouble, when to draw the line.
As long as you're professional, over talking is fine.
Mhm.
So as long as you're courteous and professional, it's fine. When I've interviewed people, I've come across a few people who would come here and then, crib about training in India and say how it's bad. How, you have to draw a fine line where you have to explain to them where, there are a lot of opportunities for training and research in India, but it doesn't align with your career goals. So the way I did it was I told them my interest is in Hemong, and I really don't see a lot of Hemong training in India, and that's curtailed over there. And all this, for example, next generation sequencing, which is sequencing circulating tumor DNA, is like standard of care almost here in the US. It's not back home. So differences like that, that's fine. But if I came into the interview and I told them, oh, in training in India is so bad, we don't have time, we don't treat our patients, we just let them on the floor, then that kind of gives me an impression, okay, so this is the environment that you trained in. So I'm not going to expect you to behave in a manner that would be appropriate for my patients. So that turns the interviewer off too. So I would try not to beat up the system that you came from. Acknowledge the merits of the system, acknowledge the advantages that it carries, tell them how you're comfortable with clinic workloads, or how you navigate the system, but realize that because of that heavy workforce, training can sometimes be affected, and for this reason I'm here. So that's the way I would go about it. But speak freely, just be professional. You're not having a chat with your drink over your buddy over a drink, but just be professional, and over speaking is fine.
Okay, that's great. Next, we have, I think, 2-3 people asking us about the UCSC. They ask you what would you comment? What would be the they say that is it necessary for us to clear the UCSC? And what would your comment on it be? And is it compulsory to do the residency in US?
I honestly do not know what the USCE is. I don't know if it's the US
US.
experience.
Yeah, I think it's so it says the USCE. Yeah. Should be the United States.
Years since I gave 7 or 8 years since I gave my steps, so I might be a little bit.
I think they mean to say United States clinical experience. Yes, USC. Yeah, somebody's saying that. Yes.
So United States clinical experience is just the observership or the mentorship that we spoke about, right? So it's just a way for them to demonstrate that you have people who have witnessed your work here in the United States. So how do I know that the letter of recommendation that you got from Dr. Julius Xavier Scott was not absolutely made up? How do I even verify if there's a person by the name Dr. Scott back in your hometown, right? So sometimes it's possible, sometimes it's not. So in that instance, I'm more comfortable looking at a letter from somebody that I know. So if there's a graduate from my university or a professor from my university and he's giving you a letter, then I trust that letter more. So that's the reason why people ask for United States clinical experience. And again, not to talk back about the stuff that we spoke about, mentorship, observership, all of it counts as USCE. Each university has its own definition of what USCE is. Some people determine clinical experience as just externships, not observerships. Some people say observerships or externships are equally okay. Remember, you have to pay a certain amount of fee to apply to each university. So it's your job to look up in the university website or email them saying, what are your prerequisites for an international medical graduate? Will you be able to sponsor a visa and so on? So you have to make that distinction whether you're eligible to apply or not. You can't apply to every program and then when they reject you, find out that was a waste of your money and effort.
Okay. Yes. All right. So next we have somebody asking us, could we lock the MLE score we get in med school and then do PG in India and later go on for a fellowship or something in the US? Does that work? Can we lock in an MLE score when we're in med school, and can we pursue our PG in India and then later on go for a fellowship abroad?
Yeah, I think I just answered that one. So the answer is yes.
Yes. Okay. Okay. Can you suggest any institutions to look up for matching, and how hard is it to get into Harvard?
Institutions for matching, as in?
I think they mean while you given your options while for the NRMP for locking in.
Oh, okay. I think so. NRMP has a list of all people or universities that participate in the match. I think so long ago, universities could say, I have 30 spots, so I would fill 10 spots by the NRMP and 20 spots I'd fill outside the match. But now NRMP, I think for the last 10 years or even longer, has a all-in or all-out policy where you say, if you want to be part of the NRMP, then you have to fill all your seats. If not, then you can't fill any of your seats. So how difficult is it to get to Harvard depends on who the candidate is, right? So if it's the right candidate, it's easy. If it's not the right candidate, it's hard. So I don't think anything is easy. I think if you put in the work and the effort, anything is possible for sure.
Great. Next, we have someone asking, ma'am, I would like to know about the coaching for step 1. Somebody says that they found some institutions in Bangalore where they prepare students for the exam. Is it necessary to join an institute for preparation in any of the steps? Or I think they need to ask you if whether we need to enroll ourselves in an institute or could we sit at home and study for the USMLE?
So I used the Kaplan study material to prepare for all my steps. And like I said, it's been almost 8 years since I gave my steps. So I'm not sure any of that is currently valid. And if you guys are all using Kaplan, I use Kaplan, Goldjan, and all those good stuff. So if you find material and you can read it on your own, that's good enough. I watched all the videos that the USMLE had, and I really liked watching the videos. I thought it made a big difference and kind of like emphasizing which points to remember and so on. So my take would be study material is always helpful. And again, everybody is different. The way people study, like some of my friends would just take a textbook and go through it and they'd be fine. And some people would need videos like me. So your preference.
Okay. So if you do not mind, somebody wants to know your step scores and when you attempted your step 1.
So I gave my step 2 CK first. Step 2 CK first, and my step 2 score was 265. And then I gave my Australian licensing exam after that. And then next year I gave my step 1, and my step 1 score I think was 252. And then I gave my step 2 CS after that. And I think at that point it was kind of like high pass, if I remember right. And then I gave my step 3 during my second year of residency, and I think it was 249 or something like around that ballpark.
Okay. There's nothing to shy away from those scores, or they sound phenomenal, in fact.
It doesn't matter. So your scores are just another part of your application. Just because somebody has a score of 265 over a score of 240 doesn't mean that guy is intelligent. That guy just did that block better than that guy on that one day. Yeah. So
correct.
The scores are just scores.
Okay. Yeah. Yes, sir. Okay. So we have a few more queries. One of the clinical exams in step 2 has been cancelled. What's your take on that? I think it's the CK. I'm not wrong, if I'm not mistaken.
I think it's the CS, the clinical skills exam, right? So I don't know how, because of the pandemic that's been closed. Yeah. I don't know if that's going to be a long-term thing. If it is closed, then it's a good thing. You don't have to spend that extra amount of money and come in here and stuff. And the clinical skills exam was always just a pass or a fail. So, you never had a score on that. I think they had, at one point, they had high pass, or I think it's called like high performance pass or something on my certificate. But yeah, so that's your thing.
Yeah. Okay. So if we take the USMLE before 2022 and apply for the match after 2022, will the score be considered, or will it be considered as a pass or fail?
I have no idea.
We'll have to wait.
I'm not going to be making stuff up. Yeah.
Okay, sure, sir. All right. So is first aid enough for step 1? I mean, so I did mention earlier. Yeah. Yes, just first aid.
Again,
Captain,
it depends on who you are. So my med school buddy was a gold medalist, and he was like the topper of his class. And for him, probably first aid was good enough. I was average in med school, I would like to say. So for me, first aid was not enough. So it depends on who you are and what type of medical training you've had, which part of your medical training you are in. Are you someone who's very strong in your basics? Then probably well enough. Are you taking it right during your first year or second year when you're fresh out of reading all of that? Maybe. And the good thing is you use those NBME exams as a good measure of where you stand. they're pretty accurate in telling you where you stand. So what I did was I prepared for my exam. I gave my NBMEs, and my score was, I think, 10 points better in my actual exam than the NBME. So if you want to find out if the NBME is good, if your first aid is good enough, then give the NBME, and if you crack it, then probably good enough. But remember, one study method that applies for one person will not apply for everybody else. Do not follow uniform study advice from anybody. Figure out your own study method.
Yes, it's always best to cater to your needs and work accordingly, as Sir says. We have one person asking, my college doesn't have the ECFMG sponsor notes because it's a new college. So what can I do about it?
Call ECFMG. They're pretty friendly people. And remember, everybody here in the US will respond to any email that you send, or if you just give them a phone call. So call them, American time, and then ask them this question. And there's always a way to get around everything. People here are very receptive, and they'll talk to you. I was afraid about picking up a phone and calling anyone during my times as a med school candidate, but now I remember that it's so much more easier. You'll find out the accurate information. You don't have to ask 10 people who might make up stuff or give you a half answer. Call people directly. And even when you're applying for residency in a certain institution, if you're worried whether you'll be eligible or not, just email them and say, this is my profile. I'm interested in to apply. You are legally permitted to ask anyone if you can meet their eligibility requirements, or you're legally permitted to ask them what are your eligibility requirements to apply. As long as I think it's illegal to tell them, I want you to match me first. I'm ranking you first. You're not supposed to disclose your rank order list, but all other sorts of communication are legal as long as it's professional.
Okay. All right. So what are the odds of matching in the US for a surgical program? They say Indians don't really get enough opportunities. What is your view on that?
I mean, it all depends. If you have a candidate like me who's matched into internal medicine, they'll tell you that internal medicine is fine. If you meet a candidate who's not matched in the US, they'll say, oh, Indians are not given priority or whatnot. To say that systemic racism or preference, if you want to recall it for another term, is non-existent, it would be a farce. There's bias and everywhere, and whether you want to call it a racist bias or bias because of other reasons, that's fine. So you are going into their healthcare system and asking them to accept you as part of their healthcare system. So they have certain preferences. They want to play their cards close to their chest. They want to make sure that you're a candidate that they can trust. The university is taking a huge responsibility by letting you in for residency, because if you screw up, it's on the university's name. So you can understand why there's a hesitancy to take everyone from everywhere else. But so many graduates have come and have established and have proven that we can be trusted too. That people do value international graduates, and uniformly almost all attendings and program directors will accept that if you don't have international graduates, programs will not be able to run efficiently. Internal medicine is definitely one of the most common fields, but like I told before, one of my friends did surgery back in India, and then he came in to do transplant fellowship over here, and he's working here in the US. So anything is possible, but the route that you take for internal medicine would be completely different from the route that you take for surgery. You have to demonstrate your hands-on surgical skills, and the routes the loops that you have to go through would be a little bit different, but definitely possible. You just have to work towards it.
Yeah. So how many years does it take to get matched, and what is the timeline?
You apply in September, you interview November to January, and then, or maybe end of October to January. You submit your rank list in February. You find out if you have matched in March, and then you join residency in July. That's your timeline.
Okay.
And all of this is on NRMP. So if you go to nrmp.org, I think you get a timeline, you get a video description of how the match process works, and that would do a much better job than what I did.
Okay. So we have somebody who's a little interested. They ask that we learn about Hodgkin's and all the different type of non-Hodgkin's in second year. Do we really see these cases in everyday basis?
Yeah, I guess my everyday basis, because I'm a hem-onc fellow. Yes. And I think part of being in the US, and I think that I'm most excited about, is that the opportunities that you have to research everything is like phenomenal. So I'll give you a one-liner about a project that I got funded for. I guess it won't be a one-liner; it might be a couple of minutes. So I don't know how many of you have heard about CAR T therapy or chimeric antigen receptor T cell therapy. But to make it brief, so non-Hodgkin's lymphoma, diffuse large B-cell lymphoma, for example, has markers, cytoplasmic markers on top of them. So, for example, CD19 is one of those markers. CD20 is another marker. We have monoclonal antibodies that recognize these epitopes, like rituximab is CD20 that we use to treat other stuff. I think that will be part of your USMLEs at one point. But CD19 is a marker that's unique on top of these B cells. And these B cells are also part of the malignant clone. One advantage we have is that even if I get rid of all the B cells in your body, you won't make any gamma globulin, so you'll be hypogammaglobulinic, but you might be, susceptible to certain illnesses, but you will still be able to survive. So what these scientists have done is that they've made a chimeric antigen receptor T cell, or in other words, they take a T cell from your own body, and then they re-engineer by making sure that they're able to express a receptor for CD19 on that T cell. And then we grow those T cells and then we give them back to you. So it's your own T cells, so you won't reject them. And now it's been genetically altered or engineered by a retroviral vector to make sure that it recognizes the specific CD19 cell. Your immune system normally should wake up, look at all the cells around you, figure out which ones are cancer cells and kill them. But one day your immune system doesn't do that and the cancer grows. That's because the cancer system has figured out a way to fool your immune system to think that this is a normal B cell. So now you've changed that by re-engineering your T cells. And now we give you the T cells back to you. Those T cells expand in your body. They recognize all these small B cell clones, whether they're normal B cell clones or the cancer clones, and they kill all the cancer clones. And this is a treatment that's been FDA approved. And this is a treatment that we use. It's a very expensive treatment. It costs around $450,000 to $500,000 per treatment. But it's very, very effective. So all those standard chemotherapy regimens like the CHOP, EPOC, and all those that we do for diffuse large B-cell lymphoma, it works in 50 to 60% depending on what type of non-Hodgkin's lymphoma you're looking at. And then after that, you have to do either a stem cell transplant or you can do some salvage chemotherapy regimen. So people who failed all these different modalities that we had previously didn't have any treatment option. And then now we have this CAR T therapy for the last 2 years, and it's highly effective. It's effective in like 50% of the patients who get it. So people who had a death sentence, now 50% of them will respond to the treatment that they have. So you can imagine how good that is. So phenomenal science, but my project is looking at how your gut microbiome or the bacteria in your gut influence the efficacy or toxicity of CAR T therapy. So a project like this, I think, would not be possible in Chennai, right? So you have to figure out, this is the advantage that I'm talking about, but this is not something that everybody is interested in. If you're interested in it, then the US might be a good place for you. So short answer, Hodgkin's lymphoma, non-Hodgkin's lymphoma, yes, we see it almost every day, but I see it because I'm a hem-onc physician. Other people might not.
So that's a little about Sir's life. So next we have, so before we close the session, we have just 2-3 more questions here. So for someone who's a CRRI in government college and who almost has no time to even sleep during med or OG postings and has decided to take USMLE, is it possible to do electives in USA without completing step 1 and step 2? Whether he or she can get through USMLE without even electives and publications. So they say that they feel like they're already late in the race and they ask whether they can do any proceed without having any electives done.
I started my USMLE process only after I was in the final stages of my CRRI year. So I think you're definitely not late, and you can get electives without your steps for sure. But it might be easier to get one with your steps too. So that doesn't mean it doesn't hurt trying. You can apply everywhere and see if you're able to ask a request. So when I say apply for an externship, what I would do personally is I would not send an email saying, "Can I do an externship?" What I would do is I would send an email with a personal statement and my resume saying, "This is who I am. This is my accomplishments on my resume," and then on my personal statement explain in a clear manner why I want to do an externship, why I want to do a residency in the United States, so that people who are looking at your application will look and say, okay, this is a guy who's a girl who's applied. I like her resume. I like the commitment that she's made a personal statement that's good enough, and then look at your application. Nobody is going to respond to just a single line email by saying, okay, yes, come on, come across the ocean and I'll let you do an externship. Be ready for a lot of rejection when you're doing this. When I applied for observerships, I applied for like 3 months before I got my first observership. And so it happens. But if you know someone, then it might be easier. With the COVID pandemic, things are a lot harder. But again, nothing's impossible. You just have to work towards it.
Okay. Okay, sir. Before we are going to the next question, I would like to tell to the participant that from now we are just going to have the doubt session. I think we can extend the doubt session for more for 10 to 15 minutes. So if you want to ask doubts to the sir, you could, because I think the session time limit is exceeded. So we are just extending it to make your doubts to be cleared. So Nikita, you can proceed with the next questions.
Okay. So NMC has not applied for the ECFMG accreditation for 2024. Will students be allowed to practice in the US without accreditation?
I'm not too sure, but my generic answer is going to be there are workarounds. If you have a question, call ECF. They are very student friendly and they work towards all of this, and there is always a workaround. Because you still get your certificate from MGR University, so I think you'd still be valid. I don't see why not.
Okay. All right. So can we do an externship at a university which doesn't require STEP scores, even if we don't wish to do residency in the US?
I think if you can, I would highly encourage anybody who's willing to even think about a USMLE process to do an observership or an externship, because then you actually get the feel of what it means to be here in the US. And we've been talking for the past hour about just the academic perspectives of living here in the United States, but think about your family life, your emotional stuff. You come back to a home that sometimes might not have anyone around, or for me it was just me and my wife and nobody else for a long time, and that can be emotionally devastating, right? It's a huge difference for certain people. And certain people cope with it, certain people cannot. So you have to factor in all the other facts of this. This is just training in the United States and being financially independent is just one part of the whole package. You lose out on so many things. My brother missed out on my wedding. I missed out on my sister's wedding. I've missed out on so many of my friends' weddings and important events. And I'm stuck here in the United States. My dad has not seen my daughter for like 6 months. I missed my grandfather's funeral. So things are not always rosy. Things are not always bright and green. Yes, we try to portray it that way because, we have to move on and take our next step and talk about the next day and so on. But you lose out on quite a bit by coming here to the United States. It's not an all-win scenario ever. So what I would highly recommend is that, and even from just purely an academic perspective, if you come here to the United States and you do an externship, you like it, you can stay. I did an externship in the Royal Melbourne Hospital in Australia, and after going there, I figured out that I probably would not be okay staying in the Australian system, so I put that in the back burner. So that is an experience that everybody can try to get. So if you can, I would highly encourage anybody who's even thinking about it to come and do an observership or an externship over here. And you can do observerships even when you're in med school. Like you don't have to be done with internship or whatnot. And you can identify if this is a place where you want to be for the next 4 or 6 years of your training or your call.
Okay. Okay. So what about resources? What about research as we are facing such a pandemic situation and we're not able to take up proper researches? Is it definitely necessary to do such papers or for getting into the USA? And this person asks whether there are any online portals they can choose for online researches.
You trying to get database research done might be a little bit more difficult. I don't know how the dynamics of that would be if you're doing it from India. If you're here and then you have access to lots of databases. Like for example, I did my fellowship in Baylor, Houston, so then I have access to the Texas Medical Center databases at Baylor and whatnot. So then it was a little bit more easier. But what I would recommend is that if research doesn't have to be a huge database research, you could publish case reports, you could publish retrospective analysis of patients that you've seen in your clinic, that are or health science research. Research doesn't always have to be clinical. You can make population-based research, healthcare-based research, just epidemiology stuff. Anything that you can get would always be helpful. So I would start shooting for some, case reports, retrospective analysis. The easiest way would be, for example, a RAS scenario or case that you saw. I think my first publication was about a Kimura's disease, which is a kind of lymphadenopathy in pediatric children. So identifying a good mentor again is going to be critical because they'll be able to tell you which is publishable, which is the route to publish and how to publish, and also be able to tell you which case to talk about.
Okay.
So the last question before we come to a halt, sir, is whether we have to take up any language exams, such as the TOEFL or the IELTS, while appearing for USMLE.
If you're able to pass the United States MLE, the medical licensing exam, then you demonstrated a proficiency in English that you don't need to demonstrate again. So you do not need to take an IELTS or a TOEFL or anything. So the question really would be, if you're trying to do an externship before you give your steps, and then that university has a prerequisite for a TOEFL or IELTS to demonstrate that you have proficiency in English. But as far as I remember, I don't think many people have that. But in the odd scenario that someone does, maybe that's the only scenario I can think of.
Okay.
That's great, sir. Sir has been kind enough to spend some time with us, some extra time with us. He's also provided us with his email
Email ID.
Yes, if required. So I think best the participants can also come through us. You can text us on our page and we can send your questions and your queries to sir. So yeah, now to Pawan.
Yeah. So actually, guys, we'll be sharing you the Aranma sir's email ID. So if you have any more doubts to be asked to him, like you could feel free to ask. I think he's open to everything. So and then thank you so much, sir, for coming today and making this live good. That's also, yeah. We can. Would you like to conclude anything, sir?
No, thanks for the opportunity. I think the whole MLE experience can be stressful at some time. So always reach out to your mentors, reach out to people who've been through it, and I'm glad to help any way I can. But thanks to both of you.
Okay,
too.
okay.
Yes. Thank you, sir. Thank you.
Thank you. Thank you so much.
Okay. Have a good
night.
So I
guess we can call it a day now. Thank you, sir. And yeah.
Guys, we have posted the email ID.
Good luck with all your endeavors, and I hope all of you match. Okay.
Yeah.
Thank you, sir. We all hope to.
You.
Yes. Thank you, sir.
Good luck.
Thank you, sir. Thank you.
So how are we to proceed?
Yeah, we can leave. Yeah,
we can leave, right? Okay. Yeah. Bye.
Thank you, guys. Thank you for patient listening.